Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. We have Amanda Elms, founder and CEO of Metis Genetics LLC, with me. Amanda, welcome to the show.
Thank you. I appreciate being here.
My pleasure. Tell me about your company and tell our audience about your company.
So I'm the CEO and co-founder of Metis Genetics. Metis is a company that's focused on increasing the value of genetic testing by providing access to genetic counseling creatively. So genetic counseling is different than genetic testing. We're not doing any of the actual genetic tests, but what we do is help people understand what a genetic test can and can't do, as well as the impact that it can have on their healthcare.
Okay, what about the technology involved in it?
So genetic counseling as a whole, because genetic testing is increasing so rapidly, the utilization of genetic testing is expected to more than double over the next 3 years. There's a synergistic need for genetic counselors. The problem is that there aren't enough genetic counselors in the labor force to even meet the current demands. And so incorporating technology is a necessity to meet that growing demand. Mm-hmm. The beauty of it is that it also makes genetic counseling less expensive. So we're really focused on automating as many solutions as possible in the genetic counseling space so that counselors can spend more time with patients that need their clinical expertise, and it makes it less expensive for the healthcare system.
How much less expensive?
On average, we can reduce the cost by over 60 to 70%.
That's huge.
Yeah.
That's a massive. Okay.
Yeah.
All right. What about equitable healthcare for different demographics?
Mm-hmm. So genetic testing is one of those areas where socioeconomic differences certainly exist. Mm-hmm. And so what we've done to help combat that is create all of our automated tools in both English and Spanish. In addition, our actual counseling services are available in over 200 languages so that we can meet the various needs of different demographics in the U.S.
What are the challenges and the rewards that you face by being a female-led company?
Yeah.
I mean, there's some stuff there that we need to bring out.
Yes. So I'm excited that there's more and more female founders, especially in the genetic testing space and genetic counseling. Genetic counseling is actually dominated by females, 98%.
Why?
I think it has the pull that females like the counseling side of genetics. So they're typically very smart women who are interested in science, mm-hmm. but also their soft skills come out because you're helping patients understand what these implications mean, mm-hmm. and you're helping them address their feelings and their concerns about making healthcare decisions. So it's really a perfect fit for someone who's interested in science and likes the people aspect as well.
I get the connection there. It seems like they would actually be more suited to really draw out what they need from other people too. Mm-hmm. More so than most men, because they have this ego, the bravado, what have you. Yeah. All right. Well, talk to me about your startup, mm-hmm. and being a female in the startup industry, because it is kind of, it's chauvinistic. Let's just mm-hmm. call it the way it is. It's male dominated, and even though there's more women involved in it, there's still things that you get to deal with. I want to bring those out, your experiences with that.
Sure. So, I think women as a whole receive less capital funding than men. Recent studies showed less than 2% of funding actually goes to women founders.
Why do you think that is? What do you think?
I hate to say that there is still that chauvinistic approach towards women-led companies,
but
is what it is. There's data that suggests that it is. I think the best thing that we can do, because there are several very successfully founded by women companies mm-hmm. that do well, is just to continue to push that envelope. For Metis, we're in the fortunate position that we've been profitable since about month 4, and we haven't had to take capital from an expansion standpoint. But at the same time, I'm very cognizant of the fact that it may be more difficult for us to raise funds in the future, just from what the data suggests. But you
don't think it's really based on merit anymore? I mean, it's just a math problem? versus a personality issue?
No, I think certainly personalities come into play. I mean, persistence, having a documented track record of what you've done certainly speaks volumes. At Metis, we have that, so hopefully if we get to that point and make that decision, we won't have a problem.
Talk to me about the keys to success that have helped you get where you are, and tell me where you think you're going to go.
Yeah. So I have over 20 years in the diagnostic space, specifically in genetics. I understand the market really well and saw this as a huge need probably 5 years ago with key players on our team, which I think is part of our success. We listen to our customers. So often now I think people are more concerned about showing revenue growth and throwing solutions out there without truly answering the need. And we've taken the time to listen to what the market needs, listen to our customers, and create a solution that meets all of that.
What makes you different than anybody else out there in your field? What makes you unique? I love that smile too, because you were like, I was waiting for you to ask me that.
We integrate technology better than any of our competitors. So having a people solution is an important part of genetic counseling. As I mentioned, being able to connect with people will always be the foundation of what genetic counseling is. But there are certainly aspects of that can be automated that improves not only the quality and consistency of the education, but lowers the healthcare costs. We feel like we have a responsibility in an environment where our healthcare dollars are limited to, yes, increase access to genetic counseling, but do it in a responsible way. So what Metis has done we have identified key strategic points throughout the genetic counseling process where we can automate services.
Like, give me an example.
We've created an educational library of videos that can be utilized in the pre-test education phase of genetic testing. So instead of patients sitting with a counselor for 45 minutes and the counselor repeating herself or himself over and over again for each patient, the patient is able to watch a video. They can rewatch that information, also share it with family members, and we can do that for pennies on the dollar compared to having a genetic counselor do it.
How far down do you drill into the genetic testing? Give us an example of what somebody has been able to benefit from from your services.
Sure. So one of the most commonly ordered genetic tests in the prenatal space is called non-invasive prenatal testing, or NIPT for short. What it can do is from a blood sample from the mother, the pregnant mother, they can isolate DNA from the embryo. And what we can do is then test the fetus's blood to screen it against chromosome abnormalities. What that does is it's a non-invasive procedure, hence the name, so there's no risk to the mother or the baby, and you get genetic information back that can help patients make educated decisions about their pregnancy. The beauty of this is that the price is dropping for almost all genetic tests, and it decreases the number of invasive procedures which have risks to both the mother and the fetus.
Now, I know that we've had people on the show that are working in this field, and they're saying that you're going to be able to actually see what is the potential for other diseases through these tests, so that you can have preventative medicine from the get-go prior to birth and be able to either stop it or correct it or reduce it.
Absolutely. So a huge part of medicine right now, or genetic testing, is the preventative genetic testing. So looking at your DNA and giving you an idea of what genetic diseases are you predisposed towards.
Right.
Eventually that will probably be available from a prenatal standpoint. We're not there yet. But now you as an adult can get that information and make decisions in your lifestyle choices, in additional screening to address that added increase that you have that's specific to your DNA.
What advice would you give other young entrepreneurs trying to make their way in the world like you did?
Be persistent. If you have, an idea that you think is something that's valuable to the market, pursue it. You're going to get no answers. You're going to do things incorrectly. You're going to have what I call, or what the industry calls, imposter syndrome. That's all normal. It doesn't mean that you're failing or you're not on the right track. Surround yourselves with people that understand your domain, have expertise that you don't don't have and lean on them when needed. Our team at Metis is the reason why we're so successful. We have excellent genetic counselors with tremendous track record of clinical expertise, but we also have advisors and executives who have been part of this entrepreneurial process before and are great advisors to me. I can't recommend having a strong team enough, because it is truly just from your own encouragement, but also to do things correctly in your business. It's wonderful to have that sounding board.
Amanda, thanks for being a guest on the show.
Absolutely. Thanks for having me.
My pleasure. You've been watching CEO Money. Thanks for joining with us. Don't forget to follow us on Facebook and sign up as a subscriber to our YouTube channel. Thanks for watching.